Hello, my name is Steve Webb. I'm one of the bariatric surgeons with Memorial Advanced Surgery at Memorial Hospital in Jacksonville, Florida. I'm going to talk to you a little bit about diabetes and weight loss surgery. Diabetes is a terrible disease. It's extremely prevalent. It is one of the 10 leading causes of death in the world. One patient dies every 10 seconds somewhere in the world from diabetes or diabetes-associated complications. It leads to cardiovascular problems with heart disease and high blood pressure, stroke, amputations. It can cause impotency, is associated with depression, cognitive decline or early Alzheimer's, and an increased risk in death from certain forms of cancer. Overall, it may cause shortening of the life expectancy by anywhere from 12 to 14 years. And even sadder is that it diminishes so markedly the quality of life during that diminished life expectancy. So the question then is, what do we do about it? Lifestyle interventions and medications are the initial treatments for this, with lifestyle intervention including weight loss, appropriate diet, and exercise. Of course, what we as bariatric surgeons know are that diet and exercise really do not resolve morbid obesity. That's not a disease that's from eating too much or from not exercising enough. It's truly a disease process. And so although we recommend, obviously, following the appropriate diet, trying to lose weight and exercising, that's not going to resolve diabetes in the morbidly obese patient because it's not going to resolve the morbid obesity. There are multiple diabetic agents, both oral and insulin in its different forms that are available, and the endocrinologist will be administering these to diabetic patients. I'll talk a little bit about type 1 diabetes. The majority of this talk is about type 2 diabetes because that is predominantly the type that we see. But type 1 diabetes is associated with a total lack of production of insulin by the pancreas. So insulin therapy is always indicated for that. Now, weight loss surgery does not resolve type 1 diabetes because it can't make the pancreas grow insulin, but it does lead to a marked improvement in insulin requirement, and that diminishes those insulin requirements, and it helps to achieve a lower rate of hyperglycemia. So it's very effective with type 1 diabetes, but it's not going to cause remission. How effective is medical therapy in general? And again, that's including lifestyle changes, medications. Well, it may help keep the blood sugar levels from being excessively high. It's not a cure. A diabetic patient is always diabetic. Type 2 diabetes worsens with time. It requires greater numbers of medications, maybe greater doses of insulin to keep the blood sugar under control. And it is a chronic progressive disease. It's not something that is cured by the appropriate level of medications. And this brings us then to talking about weight loss surgery, because weight loss surgery has been shown to be extremely effective for helping to resolve or to control diabetes. So who's a candidate? Well, any patient who has a BMI of 40 or greater, whether their diabetes is under good control or not, and in actuality, any patient who has a BMI of 40 or greater with or without diabetes is a candidate for weight loss surgery. This is morbid obesity. Patients with a BMI of 35 to 39.9 who have diabetes that's not well controlled with medication are also candidates for the surgery. And this is something that the insurance companies will approve and pay for because it's recognized that this is a condition that warrants weight loss surgery and its treatment. The last category we'll talk about is patients with a BMI of 30 to 35. Now, these patients have not traditionally been considered to be weight loss candidate patients, but it is known that if type 2 diabetes is not well controlled with medications, and if it's associated with other cardiovascular conditions, then it absolutely should be considered as part of the treatment regimen, that it will help to lower that blood sugar, help get rid of the comorbidities associated with it, especially the cardiovascular problems. So this is something that's also felt to be warranted by specialists. So what do we have for you? What kind of weight loss surgical procedures are available? We have 3 that we offer, including the sleeve gastrectomy, the gastric bypass, and the biliopancreatic diversion of the duodenal switch. I think the important thing to see is that it improves the diabetes in greater than 90% of the patients by lowering the blood sugar. It reduces the dose and type of medications that are required, even if the diabetes is not totally resolved. And it helps to get rid of the comorbidities associated with it, especially hypertension, some of the non-alcoholic steatohepatitis, liver diseases. It helps to improve sleep apnea and hypertension. So it's good for all the comorbidities associated with the diabetes as well. The sleeve gastrectomy is the most commonly performed bariatric procedure. It removes a large portion of the stomach, including the portion of the stomach that produces ghrelin, which is the growth hormone releasing agent. A lot of scientists call it the hunger hormone. Diabetes remission is at least 60% or greater. However, there's some studies in our own practice. We see that the improvement in diabetes is very much similar to that we get with the gastric bypass. So here's a picture of the sleeve gastrectomy. And what you see that we do is we start about 1 to 2 inches behind or just proximal to the pylorus, which is at the end of the stomach. And we take out the lateral part of the stomach along what's called the greater curvature of the stomach. In the wide part at the top of the stomach is the fundus. That's where the ghrelin is made. So this procedure not only is restrictive, it's also very much metabolic, and that's removing the area that creates the hormone that probably explains a lot of the weight gain and weight maintenance. The gastric bypass is a very good procedure, is one of the original procedures that was done that was proven to be extremely effective for treatment of diabetes. It alters the GI tract. We don't remove any stomach. We don't remove anything. We just bypass the stomach or bypass the top part of the intestine. The exciting thing about this is that patients that have been insulin dependent for 2 years or less have a 90 to 92% resolution of insulin dependence. In other words, they don't have to take insulin again. And many have resolution even before they leave the hospital. Overall, there's about an 80% remission of diabetes, and there's a great improvement, another 15%. So this is really a very effective treatment for type 2 diabetes. Our third procedure is the biliopancreatic diversion with duodenal switch. That's malabsorptive, restrictive, and metabolic. It's the most effective of all of our weight loss procedures. It's far and away the most effective also in resolving diabetes. There's over 85% remission of type 2 diabetes. There's a marked improvement generally in the rest of the patients. It's the most complex procedure, but it gives us the best weight loss and the best resolution of the diabetes. It's essentially combining a sleeve gastrectomy and bypass of a large portion of the small bowel. There's increased malabsorption as well as all the benefits of the sleeve gastrectomy. So diabetologists, endocrinologists, public health experts have all expressed the opinion that obesity is a disease. And you see here, this was a statement by the AACE, which is the American Association of Clinical Endocrinologists, and the American Medical Association. And they said the view of obesity as a behavioral decision is debunked by biomedical evidence. In other words, it's not because people eat too much or don't exercise enough. Obesity and morbid obesity are a disease. They said obesity is a primary disease, and the full force of our medical knowledge should be brought to bear on its prevention of treatment. And what does this mean? This means that it should be treated aggressively, that weight loss surgery is entirely appropriate for patients with BMIs of 30 and greater who have poorly controlled diabetes and other 30 to 35 with other comorbidities such as cardiovascular disease, with patients 35 and greater if they have poorly controlled diabetes. It is the most powerful option we have to ameliorate diabetes in patients with severe diabetes, and it really is effective in getting rid of the comorbidities associated with it. This is by Dr. Walter Porras, who's a past president of the American Society of Metabolic and Bariatric Surgeons, and I think this is powerful. Bariatric surgery helps to cure diabetes. There's nothing else that does that. And on a more somber note, says, "Grandpa, why didn't you get a gastric bypass?" And here we see, a sad patient who's blind, has had an amputation. He's at the dialysis center, so his kidneys have failed. And this is an example of so many of the preventable problems that patients get from morbid obesity and not having weight loss surgery. And as Dr. Porras said also, we do not do weight loss surgery to make patients thin. We do it to make them healthy. Hope that you have a good day. Thank you for listening.